I'm Angie Caliendo. I'm the Executive Vice Chair of the Department of Medicine at the Warren Alpert Medical School. I'm also the Vice President of Brown Medicine and the President of Brown Physicians. We see patients that are hospitalized with infections, any number of infections, and some of those patients do indeed have COVID. There has been a lot of questions regarding testing for COVID, and I wanted to spend a little bit of time explaining and providing some background on what influences the accuracy of the result that you get from a COVID test. When people ask, is this a good test or not? It depends. It depends on the test that you're using. It depends on how good the quality of the specimen is, and it depends on where you are in the disease course. So let's talk first about the test. And there's two general types of tests. Tests that detect the virus itself, and that's what we're using right now for diagnosing. There's also serology tests that are right now best used to answer the question, has this person been infected with the virus or not? And it's a blood test. There's been a lot of talk and a lot of excitement about this rapid test. That is a test that detects the virus, and the time to perform the test is about 15 minutes. And so this has raised a lot of interest in using this test because you can get the results so quickly. We don't know if the fast tests perform as well as the tests that take a couple of hours to perform, and we will gather that information over time. These tests that are available to us have been approved by the FDA under the emergency use authorization because it allows companies to get their tests out to market more quickly. But as a consequence of that, we know less about how the test performs because the companies don't need to do a clinical study. We're using a lot of different tests in the state right now because labs are using reagents that they can get access to. So the test that's being used in the outpatient collection centers at Twin River, for instance, is not the same test that the Department of Health is running and is not the same test that they're running at Rhode Island Hospital. So we have all these different tests out there and we don't know how they compare to one another. The other issue is the specimen type. If you're relatively mild to moderate disease, people are going to collect what's referred to as a nasopharyngeal swab. So they put it back into the back of your nose and up into your nasopharynx. Whether a healthcare provider collects it or whether you collect it, the better quality the specimen, the better performance of the test. If you just use it at the end of your nose, you're not going to get nearly as much virus as you will if you go back into your nasopharynx. As people become more ill and are hospitalized and put on a ventilator or a breathing machine, we have other methods of getting a deeper sample in the lung where there is a higher concentration of virus. But that's only on people that are ill enough to actually be in the hospital. The third characteristic that impacts the performance of the test is where you are in the course of disease. Very early on, when you maybe have very mild symptoms, you don't have as much virus in your nasopharyngeal secretions as you would when you're at the peak of your symptoms and your fever is high and you're not feeling as well. As the infection gets more severe and you have more symptoms, you could have a better likelihood of having a positive test because there's more virus in your respiratory tract. So those are three factors that impact how well these tests perform. What we don't know, interestingly enough, if you have antibodies to the COVID virus, does that mean that you're protected and you won't get infected again? And we actually don't know the answer to that question yet. But I think a combination of having adequate testing so that you can test symptomatic people in quarantine and having antibody tests so we know which people in the population have been infected and have not been infected, those two factors together are going to be very helpful in getting us out of this social distancing situation and back to work. I think it's too early to predict when that will happen, but I think access to testing will certainly help the decision making in that process.